Hello, welcome to Bonnie's Perspective on Health. I want to talk about placenta previa as a cause of antepartum hemorrhage, and it's also a leading cause of postpartum hemorrhage. But before we talk about placenta previa, do you know what a placenta is? Oh, we shall talk placenta. Did you know what a placenta is? Some people don't know it. So the placenta is the organ. It is an organ on its own that is supposed to nourish the baby while it's there in the womb. This placenta brings oxygenated blood, it brings nutrients to the baby, and also it takes away the waste from the baby. You understand? That is its use. So in placenta previa, this placenta plants low in the uterus. It can plant close or maybe covering some portion of the cervix or the opening to the uterus. Or it could cover the whole of it. Yes, that is in placenta previa. So, and no one knows the cause except you. God knows. Yes, the creator created it, and the body. So in this case, sometimes as the pregnancy grows and the placenta is also growing, it may move away from the cervix, from the cervical opening. But sometimes it's actually even the one that was partial, it covers the cervix. And it's a leading cause of bleeding during pregnancy. So most cases, the bleeding could be seen after 20 weeks of pregnancy. However, the spotting can even start earlier. But how do you know that you have placenta previa? Scan. I remember I told you guys it's always good to do a scan in pregnancy. There is an early scan that you do before 12 weeks. It could indicate that your placenta is where? It is planted low. And maybe let's watch what will happen. Because as I said, it could grow off or it could grow covering the cervix. You could spot before 20 weeks, but you could notice bleeding mostly after the 20 weeks of pregnancy. What do we do about it? You go to the hospital and we assess how to go about it. You could be given bed rest. This bleeding can be triggered by very many things, including intimacy relations, or maybe some medical examinations. But remember, in placenta previa, we don't do anything like digital vaginal examination in the hospital. But sometimes, I don't know which procedures people can be doing to... I had some people do pelvic assessment and do VEs, I don't know. But some medical procedures could trigger the bleeding. Which people are at the risk of having placenta previa? People with previous scars to the uterus. I mean, C-section scars or scars due to medical procedures like removing of fibroids or maybe some trauma. They are prone to having placenta previa. People with multiple pregnancies, people that have been helped to conceive using the assisted ways, IVF and others. People that have had previous placenta previa. I always get these questions. I had placenta previa, and unfortunately some have lost babies. Like, will I have it again in my next pregnancy? And I'm scared to tell them no, because I'm like, no, but the risk is high. So you have to make sure you visit the hospital promptly, in time, as you should. Don't skip. And don't miss out on the early antenatal scan. The management is simple. we assess the risk or at which the mother is at, because the bleeding can be fatal. It can lead you to being anemic, dehydrated, and it can compromise the well-being of the baby. Remember, it is supplying the nutrition, the nourishment to the baby. Sometimes you could be kept on bed rest and be given some medicines to grow the lungs of the baby as they prepare you. But when it is inevitable, a cesarean section is performed to remove the baby. If they are compatible with life, well and good, they can be taken to NICU and they survive. But it's all to save you, the mother. It's always the aim of saving the mom. That is important. I'll cover, I think, cesarean section in my other videos, because some people will be like, why cesarean section? Is it necessary? But a cesarean section is a life-saving procedure. If you have any questions about placenta previa, please feel free to hit the comment section and ask. Thank you. Before I sign out, the sign, how to differentiate between placenta previa and the placenta abruption, is the bleeding is bright red. It is bright red and it is painless. Like, there is no pain that prompts the bleeding. You understand? You're there and just you're bleeding, and it is bright red. Yes. Mothers, watch out. If you're pregnant and you see some bleeding, bright red, you could be having placenta previa. Hurry up, pack your bags, rush to the hospital. It is important to save your life. Yes, bye.